There's been a lot of conversations recently about healthcare workers and burnout. Have you personally experienced burnout?
Yesterday, for example, knew I was going into a kitchen where we were going to be short-staffed. I knew it was going to be a short-staffed day, so you just wake up in the morning and you think, I don't want to go in there because I know it's just going to be run off my feet from start to finish. Where tomorrow I know, hopefully, as long as nobody gets sick, we are going to be full staff. So you know that you're going to have a good day. So it varies day to day.
So I also want to talk about burnout. You mentioned earlier that people are taking time off for their mental health because they can't get time off for vacation. Have you experienced burnout?
Well, recently I had left work in pure tears from working on the COVID unit. And to be short-staffed on top of that, I left work and went home and just stared at the wall and cried because I was just mentally and physically just done.
What do you think needs to change with the compensation?
Well, to be more respected in our workplace. We're very undervalued for what we do.
Some other provinces have offered pandemic pay for essential workers who have an outbreak in their workplace. Do you think that would be an effective way to retain or recruit more workers into long-term care?
I think right now anything's a help. I don't know if it's going to retain people, but at least it's a start in saying we're trying to help and we recognize there's a struggle, and here's a Band-Aid while we look at things.
The biggest thing is the staff to resident ratios and the pay. We're all going to be old someday. And I remember when I took the RCW course, the instructor said to me, you need to look at the resident that you're looking after and picture that being your mother. You have to make sure you would do everything that you would do for your mother and don't do anything that you wouldn't do to your mother. And that it really stuck with me. And it breaks my heart, and they're being paid so poorly and they're being overworked so badly. It's a very underappreciated career. People don't realize how much we actually do. I do think that they would attract more people if it wasn't such a heavy workload.
There's been a lot of conversations recently